Hello guys, welcome back to HealthExplained. In today's video, we are going to talk about Caroline Wozniacki's diagnosis of rheumatoid arthritis. Caroline Wozniacki is a Danish professional tennis player who ranked number 2 in the world. She opened up about her diagnosis of rheumatoid arthritis. In 2018, she won her first Grand Slam at the Australian Opens, but one morning woke up after playing in a 3-hour match the day before in excruciating pain and unable to get out of bed. In fact, she was in so much pain that she felt, in her words, like she had been hit by a car and had mono at the same time. After numerous appointments with doctors, she learned that she had rheumatoid arthritis, an autoimmune disease that causes stiff, painful joints. Going from being a strong athlete who could play 3 hours of tennis to being barely able to get out of bed is a scary thing. So what is rheumatoid arthritis, what causes it, and how is it treated? If you're interested, then stay tuned for more. And if you enjoy these sorts of content, remember to hit the like button and subscribe for more. As I mentioned earlier, rheumatoid arthritis is a chronic inflammatory condition that can affect different parts of the body, but most commonly the joints. People can have symptoms that present continuously, but some symptoms can alternate or completely resolve. Wozniacki stated herself that she can have bad days and good days, saying that she will go all out and do everything, but if she doesn't feel well, she has to be kinder to herself and her body and not get frustrated. The severity of symptoms can also vary from person to person, and when Wozniacki was first diagnosed, her husband David Lee had to carry her out of bed and onto a plane from Montreal to Cincinnati, where she was going to be playing the next day. The specific cause of rheumatoid arthritis is not known, although there are some factors that can make you more susceptible. It most commonly presents in middle-aged female, so Wozniacki is a little younger than the usual population. This helps differentiate rheumatoid arthritis from the more common osteoarthritis, which is a wear and tear problem of the joints that presents in the elderly. Rheumatoid arthritis also has a genetic component, but Wozniacki stated that no one in her family had the disease. The most common symptoms of rheumatoid arthritis is joint pain. Joint-related symptoms usually include pain, redness, warmth, and stiffness that can persist for more than an hour in the morning. The joints in the hand are often the first joints that are affected. Rheumatoid arthritis of the hand can also cause damage that compresses against the nerves in the hand and lead to carpal tunnel syndrome. Other joints that can be affected includes the elbows, the shoulders, ankles, knees, and hips. It can also affect the neck, and if you need surgery, a doctor may decide to get an x-ray of the neck to see if there is a need to protect the area. Other symptoms of rheumatoid arthritis includes muscle weakness, skin problems, eye problems, lung problems, and problems of the blood vessel. So, how do you diagnose rheumatoid arthritis? If a doctor suspects that you may have rheumatoid arthritis, they will first collect a complete medical history and physical exam. A doctor will suspect rheumatoid arthritis if he has signs of inflammation in 3 or more joints lasting 6 weeks or longer. They may want to do blood work to look for elevated C-reactive proteins or erythrocyte sedimentation rates, which are signs of inflammation in the body. In order to confirm rheumatoid arthritis, they will look for the presence of rheumatoid factors and anti-CCP, which is a marker that is specific for rheumatoid arthritis. In some cases, X-rays may be done to rule out other diseases, although it is not necessary for the diagnosis of RA. The goal of treatment for rheumatoid arthritis is symptom control, minimizing joint damage, and improving quality of life. Rheumatoid arthritis will damage joints over time and is irreversible, leading to significant impairment in the quality of life. Thus, Early treatment is effective in reducing symptoms and slowing damage to the joints. Almost all people with rheumatoid arthritis require some kind of medication in order to control their disease. Medications known as disease-modifying anti-rheumatic drugs, or DMARDs, can reduce inflammations of RA and prevent destruction of the joint and preserve function. Your doctor may also recommend other medications such as NSAIDs, including ibuprofen and steroids, which may also help to reduce the inflammation. Although almost everyone needs medication, it is important not to undermine the effects of non-drug therapies, which can improve quality of life and help with symptom control. Although some people modify their diet, there is no specific diet that has been shown to cure rheumatoid arthritis. That being said, healthy eating is almost always recommended and can decrease risk of other complications such as heart attack or stroke, which are associated with RA. Some studies have shown that smoking and alcohol cessation can improve symptoms and can improve the effectiveness of RA drugs. While it is important to rest inflamed joints and painful joints, exercising and staying active have been shown to help with fatigue associated with rheumatoid arthritis. Lack of activity, on the other hand, can lead to loss of joint motion and muscle strength, which can lead to a feeling of fatigue. Although rheumatoid arthritis is an unfortunate disease, it is important not to let the disease define you. After her diagnosis, Caroline Wozniacki went to play in the 2018 US Open without a drop in her result, and eventually went on to win the 2018 China Open in Beijing without dropping a single set. If you learned something from this video, remember to give it a thumbs up, and if you enjoy contents like these, remember to subscribe for more, and I'll see you in the next video.